So you talk about a number of different therapies that you use, and it seems like in this country, when we're raising money and trying to find solutions, we're trying to find the cure. Do you think that even exists, that there is one cure that will take care of cancer? Because it seems to be so different in so many different people.
Right. Well, the quick answer is no, right? And why is that, Scott? The reason is because cancer is a multifactorial disease. At Hope for Cancer, as we spoke about in our previous sessions, we talked about the 7 key principles of cancer therapy, right? And I'll go over them very quickly. Non-toxic cancer therapies, oxygenation, detoxification, nutrition, antimicrobial therapy, the immune system, right? That it's so important. And of course, the emotional, spiritual aspect of disease, right? And so cancer definitely is a multifactorial disease, and we have to address it in a multi-treatment approach. Recently, there was a wonderful book that came out called Cancer as a Metabolic Disease by Dr. Thomas Siegfried out of Boston College. And in this book, Dr. Siegfried was able to list the 7 hallmarks of cancer. One of them is angiogenesis, the necessity of cancer cells to form blood vessels so that it could get nutrients and expel waste. Because think of a cancer cell as a bully, right? So it needs a lot of roads to come in and feed it with the nutrients that it requires. So Dr. Siegfried realized that a cancer cell needs to have increased blood supply so that it can continue to grow. So that's just one of the 7 hallmarks of cancer that he described very eloquently in his book. So our therapies are geared at addressing the hallmarks or characteristics of cancer. And Scott, this means that in an integrative, alternative, holistic approach to cancer, it does not matter what type of cancer the patient has. So they say, Dr. Jimenez, have you treated this very rare type of sarcoma, or this nasopharyngeal cancer that is more common in Asia, not so much in the Western Hemisphere? And yes, we have, but we haven't treated many of them. But the point is that we're not addressing the cancer type. We're addressing the hallmarks of characteristics of cancer that make cancer a multifactorial disease process. And I like to say we're not treating the cancer in the patient. We're treating the patient with cancer, right? And so, no, we'll never, in my opinion, find a magic bullet or one drug. Even, Scott, you know, when they give chemotherapy, the conventional doctors, they do 3 or sometimes even 4 chemo. And that's in combination with radiation and maybe after surgery, right? Why? Because they don't know what chemo will have some effect or a lot of effect on the cancer cells, right? So even in the conventional world, they realize that it has to be approached in a multi-treatment protocol.
Hi, and thanks for watching this video. If you like that video and you like our channel, the best thing you can do is support us with a Patreon donation. You can find the link here on the right. Also, subscribe to our YouTube channel. Again, that link here on the right. While you're at it, be sure to check out some of our more recent videos as well. You can find those right below. Thanks again for watching.